Hospital and health system care teams provide amazing care to countless patients every minute of every day. But they are human, and mistakes do happen. No one pretends otherwise. If an error is discovered, it's important that anyone feel comfortable reporting it and sharing that information with the patient as well. Sometimes saying sorry, the right way, makes all the difference. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hedderly with AHA Communications. CommonSpirit Health, a vast network of more than 2,600 care sites spread across 22 states, has worked to adopt an organizational culture of transparency and compassionate communication. In fact, it created a toolkit around that effort that anyone can adopt. As we hear in this final episode of AHA's Safety Speak series, hosted by Joy Lewis, Senior Vice President of Health Equity Strategies and Executive Director of AHA's Institute for Diversity and Health Equity, a feeling of psychological safety not only benefits patients, but impacts equity internally within the organization by allowing anyone to freely speak up, regardless of role or department. Her two guests from CommonSpirit Health are Beth Miller, System Director of Patient Safety Performance Improvement, and Austin Peterson, System Director, Patient Harm Prevention.
CommonSpirit team, Beth and Austin, thank you so much for being here with me today and welcome to Safety Speaks. I really am looking forward to exploring this topic of candor and how accessible it is as we think about advancing equitable care. And I think we should start really just with setting the stage. I think candor is familiar to those folks who work in the quality improvement and patient safety space. It's familiar language to them, but others of our listeners may be wondering what exactly is candor, which stands for communication and optimal resolution approach. So can you just elaborate on what exactly candor is? Let's pitch that to you, Austin.
Sure, I'd be more than happy to. So there's a couple of different ways to pronounce candor. Some people might call it a CRP or a communication resolution program. We've just adopted the Agency for Healthcare Research and Quality's language of candor. As you alluded, is a communication and optimal resolution program. And really it's a patient safety program to help healthcare organizations respond transparently and effectively to adverse events when they reach our patients. The key components of it is really emphasizing early communication, providing a thorough event review utilizing RCA squared, and providing resolution. And this whole program is about fostering trust, not just with our patients and families, but also with our staff members if they make a mistake that leads to a potential candor event. And the ultimate goal is to try to make what's right that we can to our patients and family, but also improve our healthcare system so it doesn't happen to anyone else. And I'd just like to take a moment and start by saying I'd be remiss by not acknowledging some key individuals in our industry who has developed this transparency movement of communicating events to our patients and families. And the list I'm going to say is not exhaustive, and I apologize in advance for missing anyone critical. But our work at CommonSpirit Health has been built on many others, such as Dr. Lucian Lee, Dr. Tim McDonald, and Rick Buchman with their 7 pillars, and Dr. Tom Gallagher and his studies advocating that patients and families value compassionate communication and an honest apology post-air. And also our patient advocates who keep us honest in the healthcare industry. But I want to shift again to discuss the Agency for Healthcare Research and Quality, who developed candor with some key individuals within our organization, Linda Ubaldi and Dr. Morelli at Dignity Health, and also Barbara Pelletreau, who ensured candor was successfully adopted across all Dignity Health and now CommonSpirit Health before her retirement. As a healthcare organization that collaborated with AHRQ, Dignity Health contributed to the creation and the refinement of the Candor Toolkit that is open access and free for everyone to adopt. The collaboration involved providing insights and feedback based on their experiences with our patient safety leaders and communication practices. And it really helped shape the toolkit's content and the implementation strategies that exist today.
Wow, thank you so much for that context. And I would imagine candor is something we can all get behind because what you just outlined for our listeners is really a level of humility that the healthcare system brings to the patient care experience. And really focusing on being transparent and learning and improving, and through all of that, then really creating an environment of trust. So, can you go a little bit further and talk a little bit more about how you implemented the candor approach inside and across such a large system?
With any large project such as this, it really needs to be led by our executive leaders who say that this is the right thing to do and get behind it to push all of us in that direction. Again, that was led by Barbara Pelletreau and Dr. Robert Weeb. Initially, because we were smaller at Dignity Health, we had the opportunity of providing these 2-day workshops where key leaders of the hospital would be our chief nurse, chief medical officer, quality directors, patient safety leaders, our claim leads, who get together and they learn about the principles and foundations of candor while also practicing that empathetic communication. Now, with the merger of us becoming CommonSpirit Health spread across 22 states, 150 facilities, and 2,600 care sites, it is impossible to do that 2-day workshop. And COVID really forced us in a new direction due to constraints on providing education in a new way. And we did this via electronically using Zoom, having 4-hour sessions of going through the whole training and people practicing. But it's really hard pulling our leaders away for that long of a time when they need to be with our frontline staff and our patients and our families. So we've revolutionized what we do, and now we provide this in our learning management system in 4 self-paced modules that all of our leaders go through. And we say all of our leaders, if you're in a leadership capacity, we recommend that you go through Candor. That is completed by having a live practicum where Beth and I reinforced the training with experiential learning. And we've also rolled out an advanced candor series where we include many unique scenarios that our leaders come across. And as you alluded to, we've trained a lot of people. To date, our organization, we've trained over 1,300 leaders, including our physicians. And we're continuing to push and ensure that everyone receives this training.
That's massive. You're really doing this work at scale, and it's really interesting how you've evolved your approach pre-COVID and post-COVID. But at the end of the day, it sounds like transformational leadership is what's really needed to move the needle here. So, talk about that transformation. How has the Candor training program transformed your organization's approach to patient safety and equity? Beth, can you elaborate on that?
I love that question, Joy, and I think it's an important one. But I think to try to sum it up is that Candor's success really ultimately relies upon robust event reporting. People have to feel free and comfortable to report safety events, quickly and often in order for those things to get escalated and then for the Candor program to effectively be implemented and launched and for all of those pieces to start to come together. So, really, our organizational culture plays a big part in the ability to achieve any of this. We have to know about events in order to then act. And CommonSpirit Health has invested heavily in establishing psychological safety in order to make it easier and then safer for teams to speak up and report. And I feel like this is where Candor really impacts equity internally within our organization is that psychological safety really seeks to ensure that everyone feels safe and comfortable speaking up regardless of their role, regardless of their department and where they sit and within the organization. And so we feel like it's been an important aspect of equity internally as we work with our teams to try to help improve internal communication. But then obviously it also does affect our patients as well.
Right. But you've done a really good job, it sounds like, of having your workforce, each member of your workforce, regardless of where they sit inside the organization, to see themselves as a health equity influencer, if you will. We always talk about how culture eats strategy all day, right? All the time. So you've also invested in creating that culture of safety where people feel comfortable speaking up. I imagine you're tracking and leveraging data and analytics to really inform and drive your actions in this space. What tools, dashboards, scorecards, what are your mechanisms for tracking progress and outcomes?
Great question. And again, I would say we're using all of those things. We're using various reports, dashboards. We've customized and again invested heavily in all of our different analytic tools to make sure that we're using what we have available to us, but then layering on that candor lens to see how the things that we're currently measuring, we can then also include specific elements of candor in those measurement principles. And so we use a ton of various scorecards, dashboards that we develop internally in connection with our event reporting system so that way we can make sure that data is shared appropriately with various stakeholders at different levels in the organization. With an organization as large as ours, data sharing amongst the different layers, can be quite a challenge. But we've spent a lot of time with our teams developing those specific things so that it can be shared effectively, but also in a more simple fashion so that it's a little easier to understand. Data is a powerful tool, but it's only as effective as someone can understand it. And so we spend a lot of time making sure that it's displayed and presented in a way that's easy to digest so then people know how to act upon it.
Can you share a little bit more about the different audiences that you're reporting out to? Does it go all the way up to the board? Are you sharing this information with community leaders, community stakeholders, internally? Who are your target audience?
Honestly, it's a bit difficult to answer because we try to customize various reports and information based on that particular audience. So the information, shared with a patient safety quality leader is really going to focus on how they impact the work, versus information shared with, an executive leader is then going to focus maybe in a slightly different area with relation to how they impact the work. So the data does, look a little different depending upon what your role is in the organization, but it all comes from the same place. So it's the same information, just presented in a slightly different way depending upon the role.
Thank you for tuning in to this episode of Safety Speaks, the podcast series dedicated to patient safety, brought to you by the American Hospital Association. I'm Dr. Chris DiRienzo, the AHA's Chief Physician Executive and a champion of the AHA Patient Safety Initiative. AHA's Patient Safety Initiative is a collaborative, data-driven effort that lifts up the voices of individual hospitals and health systems into the national patient safety conversation. We strive to catalyze and connect healthcare professionals like you across America in your efforts to innovate and improve, and to bolster public trust in hospitals and health systems by helping you share your successes. For more information and to join the 1,500 other hospitals already involved, visit aha.org/patient safety, or click on the link in the podcast description. Stay tuned to hear more about the incredible work of members of the AHA's Patient Safety Initiative. Remember, together, we can make healthcare safer for everyone.
Once you have those data, the goal, of course, is to make the data actionable, right? So can you talk a little bit more about how implementing this candor training program has actually yielded a positive outcome on your patient safety incidences? How are the trend lines shaping up for you? Austin, what do you think about that?
So I will say that safety is a moving target. Initially we started with the IOM and the 44,000, 98,000 deaths per year. And then we get better ways of looking at what a safety event is. And we see that the numbers jumped up to 220 to 440,000, or it's the third leading cause of death in the United States. So we put in checklists, we put in standardization. We're able to reduce CAUTI, CLAPSI, VTEs. That's great, but that's only one part of patient care. What else is out there that we can continue to move? So I'm going to say that it's a constant moving target as we learn more as we go there.
That's a really good point. We never say you've achieved health equity because there is no endpoint, right? There's this constant journey that you're on to refine, to iterate, to do better. And so I would imagine when we look at the triad of quality, patient safety, and health equity, it's kind of that same mantra. You're always working at it. You're always looking to improve and do better. Now that you've really gotten folks on board, how do you plan to sustain your current efforts and maybe even build on those efforts? So you've got some wins. How are you going to sustain those wins and bring others along?
I love that question. I think sustainability really of any program is always, always a challenge. Lots of competing priorities. It's obviously a heavy lift to get things going, but it's almost even more difficult to keep it going. But I think that there's some really exciting developments in the healthcare landscape, especially recently in this last year, that will help candor to sustain and then maybe even be more in the focus in the future. One of the things that is top of mind is the patient safety structural measure recently passed by CMS. it directly addresses candor specifically in domain number 4. And so we're excited about that, focus that's being put into play, because I think it's going to help allow our sites who have had that longstanding history of candor to be recognized in a different way for their efforts. But it also helps as an organization to help really look at those additional feedback loops that maybe we need to strengthen, which then will help with sustainability. And I also wanted to mention, the AHA's focus on health equity, I also think is a great contributor to helping with sustainability of the program, because the AHA is demonstrating, that this focus and our work and our mission as an organization is relevant, and there's still a lot of work needed in the industry. So I think both of those things will really help with sustainability.
Yeah, I think you're spot on. They complement each other well. And I do want to recognize CommonSpirit Health for the great deal of work that you've engaged with us around our health equity roadmap, and congratulate you for having all 142 of your eligible hospitals participate with our HEDA, our Health Equity Transformation Assessment, and continuing to do the great work of doing equity, as I like to say. So I thank you both for joining us today and for sharing your expertise and your on-the-ground experience in implementing a candor strategy to address patient safety outcomes. Keep up the good work. Thank you for being so dedicated and innovative in your approaches.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.